Hi, everybody. Welcome to our Navigating Education series. I'm Dr. Melissa Durtschi here at Navigating Education in Centennial, Colorado. I'm going to let you know a little bit about our office, and then I'd love to welcome our guest today, which I've got lots of questions myself, and I'm just so excited for your wealth of knowledge. So Navigating Education, we do two different things here. The two main things that we do is we test for learning disabilities, so things like dyslexia, dyscalculia, dysgraphia, things like that. And then the other side of our business is we help families be able to get services that they need, like through an IEP, individualized education plan, or a 504 in the school system. So we attend right alongside you at the meeting and help to bridge sometimes that gap that can exist between, you may not have background in education and know exactly what you can ask for. So we're there to help support and make that bridge between home and school. A couple of housekeeping things for our webinar and for our guests that are joining us live today. If you'll put the questions into the while the presenter is sharing, then we will answer those either while Dr. Amy is talking, or we'll have a question and answer section as well. The questions will go to the moderators, and then they will post them for myself and Dr. Amy to see. And any handouts for this webinar will be included in the description. If you're watching this after the fact, then it will be on our YouTube channel, and any of the handouts, things like that, any additional questions that are answered, all of those will be in our description of this webinar. So today I'm here with Dr. Amy, and Dr. Amy Elsila is from Hellerstein Brenner in the Denver metro area, and we are in Colorado. And I'm so excited, Dr. Amy, for you to be here today, because I know that there's a lot of people that have questions about, because I see them day to day here in our office. They might have, let's say, dyslexia, and then when we're testing, there's like this visual thing that might be going on for them. And they're like, well, we've had our doctor check their eyesight. And so I'm so excited because our topic today is on this visual processing thing and moving beyond the 20/20 eyesight that a lot of people think of when they think of, if there's visual issues, then it's this idea of, oh, eyesight, do I need glasses or not for 20/20 eyesight? So really excited to learn from you today. And I know that this is going to be very beneficial for lots of our guests, because I have lots of people asking questions, and I'm like, I have the place for you. Let me get you their number. So we're so glad that you're here, Dr. Amy. And I'm going to turn the time over to you to let us know about you, and then also about this idea and topic of visual processing.
Wonderful. Thank you so much. I am so excited to be a part of this. And likewise, we have a lot of mutual patients, and there's discussions of, what is this overlap between learning challenges, maybe dyslexia, maybe attention deficit, and where does visual processing fit in the mix, and how it might mimic other sort of diagnoses or be right alongside them. And so we'll talk a lot about ocular health exams and comprehensive eye visits, but then how do we go the layers deeper into visual processing, and really how does the brain process what it is that we're seeing? So I do have a PowerPoint presentation to share with you. I am really excited that we have kind of this small group, which will allow more time for interaction and questions. And if you need anything repeated, or if something doesn't quite hit or make sense, feel free to put a question in the chat so I can better clarify. So I'm going to share my screen, and we'll just make sure everybody can see what I'm seeing here. Potentially. Great. Are we all on that cover page? Okay, excellent. So today's title is The Critical Link Between Vision and Learning, and just more than 20/20 eyesight, which is one of maybe 18 measurements that we're doing in this comprehensive eye exam. That just refers to clarity of vision, but we understand there's so much more. So just a little bit about myself. I would consider myself a developmental or behavioral optometrist. So this goes beyond glasses and contact lens prescriptions or ocular health. We're really looking at vision development, even from childhood. As infants, we can even start to look at that visual development and make sure there's no roadblocks in how our eyes are developing to work as a strong team. I specialize in pediatric vision, binocular vision, and it doesn't have to be just children. You know, there are adults with visual processing concerns. There are adults with eye turns or misalignments. So I also see adults. And we know that following concussion and brain injury, that visual system can be very disrupted. So I also see patients for visual rehabilitation. In addition to speaking at events like this, I'm also a mentor to fourth-year optometry students, which I really enjoy that teaching aspect. And I came to Hellerstein and Brenner about 9 years ago as an intern myself. So that's kind of how I got my footing in our practice, and I haven't left since. So let's talk about developmental optometry a little bit deeper. You know, our purpose, we're not setting out to cure or treat learning disabilities, and I would never suggest that. Our goal, and I love this from Sid Groffman, who is a kind of pioneer in visual development. He says, our goal in the purest form is to remove the visual barriers to learning, to make sustained visual tasks such as reading as close to effortless as possible. I want my patients and these students or children to be able to do these visual tasks without a whole lot of effort, without pain, without strain, without headache, and without a whole lot of cognitive fatigue that's going to cause disruption in that visual pathway. So we're going to interact with a true false. I'm not going to put anyone on the spot, but I just want to make sure that we're thinking about, you know, how does this impact children in school? So true or false, 1 in 4 children have a vision problem. So I'll let you think on it. If you want to throw it in the chat, you can. But the answer is, as you may have guessed, true. So about 25% of children have some form of visual problem, whether it's the need for glasses, but more so these binocular or eye teaming visual concerns. So about 1 in 4. Would you agree, true or false, that vision is our dominant sense for learning? That is also true. So when you get really into brain processing, we understand that vision, of our 5 senses, vision has more brain real estate than all other 4 senses combined. So our brain is set up to be this visual brain. And 60% of children with learning problems also have visual problems, and this may increase in special needs populations. And as you may have guessed, that is also true. So while we just discussed vision trumps all other senses, and what do you think we're really seeing with? This comes from John Medina, who wrote the book Brain Rules. So you may have guessed, we're actually seeing with our brains. Without the brain, we can't really process that visual input, and we're going to dig into that a little bit more. So how do we assess this? So I want to walk you through kind of our process. Where do we start? How do we assess? How do we measure? And what sort of symptoms you might be able to recognize or find. So I'm going to share with you the developmental model of vision. And this is created by Dr. Hellerstein, our practice owner and my mentor. And so we're going to talk about these layers in this rainbow and how each of these different pieces layer and are kind of the building blocks of vision. So at the bottom, we have physical integrity, and that's what you might think of when you're thinking of your annual eye visit. So we're looking at ocular health, structure of the eye, the visual pathway, and eyesight. And remember, that's just one little piece. So clarity of vision. So in that comprehensive exam, we do measure visual clarity. That is important. In order to have good visual input, we want the clearest image possible. And again, 20/20 is just one of those numbers. In most school screenings or pediatric visits, you can think back to how they measure your child's vision. We cover an eye. Can you read the chart far away? We cover the other eye. Can you read the chart far away? And often we don't even check their near vision. We assume that children have great focusing up close, and it's not until late 30s, early 40s that we might need reading glasses. That is not always true. We could actually have visual strain up close, and it may go missed in a routine screening. We will measure for glasses and/or contact lenses, and we'll look at ocular health. So in that top photo, we're using an instrument, a microscope, to examine the front of the eye. At the bottom, you might see that scary looking photo down there. That is a retinal image with all sorts of conditions represented there, but we have tools to either dilate the eye to look inside of it, or photography with an optomap to look inside the eye. So we're assessing health front to back. We're also looking at peripheral vision. Sometimes if there's been trauma or stroke or an injury to the eye or the pathway, we might have a field loss. So that could really impact how we're moving through space. So that is at its basis, the structural health exam. But my favorite part is the binocular vision evaluation. And so we call this visual efficiency, or how the eyes are actually working together. And we'll call it the 4 F's for fixation, looking and pointing our eyes; following, being able to track an object or track words on a page; fusion, that's the eye teaming and eye control, or coordinating our eyes; and then focusing, which is kind of that clarity of vision. So there are 17 different visual skills that we're using for learning. I'm just going to name a couple. This list is large. So eye movement control and tracking, absolutely. Focusing near and far. So it's not just can you make the letters clear, but can you change your focus to the board, then to your paper, then to a device? There's so many different locations for focus, and we need to be able to sustain focus, keeping it clear and teaming our eyes together for a variety of tasks. Be able to sustain alignment. And so when you think about looking up close at your cell phone, at a book, our eyes are actually crossing or converging. And if we struggle with that, we may say things look double. We may get strain and pain in and around our eyes, or a lot of our kiddos with tension headaches that show up in their temples or across their forehead. They're recruiting all these other muscles to help them force their eyes together, and they're having symptoms because of it. We talk about peripheral and central vision, so being able to see clear letters, but also being able to be aware of our periphery. So can you think of maybe your own child or a friend who they just seem to go full speed, and they might bump into a wall or clip a table or bump a chair? Their periphery may not be working for them, but against them. They're kind of closing off that visual information. And so it can really impact balance. It can impact depth perception. It can impact just kind of our motor control. Our eyes are leading our body, but if we have a mismatch, we're going to have inaccurate movements and responses. Color perception, and then that relationship between vision and gross motor, vision and fine motor. And we'll dig into a little bit more about that visual processing next. So all of that's happening at the very first exam. We're looking at ocular health, eyesight, structure, and then all of these visual skills. And so I'll often ask parents or educators, what do you notice? What's showing up? What brought you in today that made you think that there's something going on with vision? So some of the top 5 or most common symptoms you might notice are skipping lines or rereading. We're losing our place. We're not tracking accurately. Or reading comprehension. So it may not be that we're not able to understand the words. Think about the kiddos that the parent reads the story and they remember everything in detail, but when they're reading on their own, they're focusing so much on just getting word by word by word that we lose the content, we lose the details. It's hard to remember. Homework takes a lot longer. It can be frustrating. We might see these patients shut down. It just is so laborious to get through the activity because their eyes are a roadblock. That visual input is a struggle. Reversals, so letter reversals, sometimes can be a visual processing of directionality, laterality. They're getting some confusion there. And short attention span with reading. Now this one, like we talked about, there could be comorbidities or multiple diagnoses going on at the same time. But imagine if your eyes are really tired, let's say you've got a big project that you're working on, or you're reading for a long period of time, you might need a visual break. So you might see this child in the classroom kind of looking off. They're trying not to keep their nose in the book or their eyes pointed on the paper because it's too difficult and they just need a break from eye strain. So they may look inattentive, but they could be taking a visual break. There's a vision checklist that has a couple more here, and this comes from Dr. Hellerstein's website. It's a resource that I can also give to you, Melissa, so we can post that. But you might see an eye turn. Not always. You might see a different head posture. What if we're aligning to look with one eye, or we're maybe covering an eye to use one or a favored eye? So you could see an abnormal head posture that could be actually a clue to a visual processing problem. Squinting or closing an eye, excessive blinking, like they're just trying to make it clear or refocusing, poor eye-hand coordination or bumping into things. And then stamina can be an issue. They might fatigue really easily. We're reading 3 or 4 minutes, we're doing great, and then we start to tank or we're almost falling asleep in our book.
One of the things that I find fascinating when I've looked at some of the reports that come my way from your office is there's a chart where it has the eye tracking and what their eyes are doing while they're reading. And it's all over the page. And it is validating for the family and that child to see, look at how much effort you have to put in. It's giving them quantitative data for how much effort they're putting in order to maintain focus on a reading task. And I'm like, yeah, if my eyes were doing that, I would be exhausted and need to take the break that you were talking about.
And I almost could swear you've seen my PowerPoint, because that is coming
Oh,
up next. Yeah, and that's perfect, because you're absolutely right. I can measure it and I can see it. And I might do a tracking activity with a child in our exam room and go, wow, did you look at how their face is tense, their jaw is moving, their eyebrows are lifted, and how much effort that is? And you're asking them to read for 20 minutes. And we all go, whoa. And then the tool that Melissa is talking about is called the Right Eye. And it's actually a computer-based program with a video recording at the bottom that will track eye movement. So we'll get into that almost right now. These are an example of some of those symptoms you might see. This little girl is squinting, straining. This little boy here, he's doing a visual motor task, but he might actually be occluding that left eye so he's not seeing double, or because he's having a really hard time focusing up close. I will point out too, asking young children, especially about double vision, can be tricky. They may not have the vocabulary or the understanding that they are seeing double or 2 images. And sometimes it's like an image overlap, or it's just unsteady. So it might be more close to that upper right image where it's not that it's 2, but it's kind of overlapping. So we'll again look at near point focus. Can we converge? Can we diverge? Looking at the flexibility of these skills. And I want to get into those videos. So here's an example of what I might see before vision therapy in the exam room. So I'm just going to let it play and you guys can kind of form your own observations, and then I'll let you know what I think about the video. So his instructions are to follow the ball, not to move his head. What are you seeing there? Now they're going to do one eye at a time. But do you notice he's fixating? We're good for a little bit, and then our eyes dart off. And this is really out of his control. He's seated, he's paying attention, he's trying to follow instructions, and he's struggling to keep fixated on the target. He almost has to look off the strain that's happening, and the accuracy is pretty poor. So imagine how his performance might look for playing a sport, trying to follow a ball and maintain that fixation and following accurately, how this might impact reading fluency if we can't keep our eyes in a focused pattern. And I'll share with you an after video. And believe me, this is the same child with a haircut. This is following vision therapy. And again, instructions are the same. Follow the ball without moving your head. And what you may not be able to hear is she's actually asking him arithmetic and math problems. So we're trying to integrate auditory, visual, and cognitive processing, and he is doing amazingly well. His face is relaxed. His eye movements are accurate. He's not lost fixation. Now he's spelling. Doing a great job.
Dr. Amy, how
Yes.
about how long of I have a lot of people ask me that, how long can we expect? And I always refer them over to you guys to ask those questions. But for instance, for this child, about how long of tutoring, training, therapy?
Training or therapy? Yeah, that's an excellent question. So certainly with any case, it's going to be patient dependent based on where we're starting, based on the visual processing testing that comes back. But I could say roughly 6 months is pretty typical length of therapy. And think about, we're rewiring eyes and brain. So we're building new muscle memory, and that takes time to build the foundations. I have some patients graduate in 4 to 6 months. I have others, if there's more complex visual input, like an eye turn or double vision that we're starting with, it might exceed 6 months, but I would say average is probably 6, but it could be 4 to 6, it could be 6 to 9. And when all of the testing comes back, we do a consultation with the parents and or depending on the patient's age, if they're a high schooler, we might have them in on that conversation too, to really talk about length of therapy and what our estimates are. We also do check-ins or checkpoints every 8 sessions or so that we can determine how that patient is progressing. Are they ahead of schedule or are they behind? And it's not without at-home practice. So much like any other therapy, I often use physical therapy as an example because many parents are familiar with that. But it is building muscle memory. You come in office, have a therapy session, and then there's activities and exercises prescribed for about 15 minutes, 4 to 5 times a week. So that's kind of the structure of therapy. But again, everyone is starting at a different place. And so we'll tailor the program depending on that child's needs. And here is that lovely eye movement test that you were talking about. So, yeah, this comes from the right eye, and you'll actually be able to see it now dynamically versus just in a report. If a patient is not yet reading or they don't have enough sight words to get through a paragraph, we might do just an eye movement test. So we can test our smooth eye movements, that's a pursuit. Following something in motion, we might use that for eye-hand coordination. And we can check our jump eye movements, which the terminology here is a saccade. So that's transitioning our focus from one object to another, these jumps back and forth. And that's the primary visual skill we use for reading fluency. So if you have a line, you're reading across, jump, jump, get to the end and go to the next. So I'm going to play these videos. On the left side of your screen, you will see a pursuit. Now, what the child is seeing is a little circle going around their screen, and they're trying to follow it. You can see we're not always on that circle. If you look at the pattern on the right of your screen, let's see if that one will play for me. It may not, but you can see that the path is much more organized. That circle is much more regular, repeatable. Less times did we lose fixation and focus. And the same is true for the saccadic videos here. So you're looking on the left side of your screen, but under saccades, those jumps back and forth. And so we can see we do pretty well. And then we have some that are really off. So this is the child that may be skipping words, rereading the same line over, especially those little words, if and the and, we just might pop right over them or miss them. And in the second example on the far right, you can see the accuracy much more repeatable, smoother. So now we're maybe losing our place less often. Our speed of reading may be more quick. We get through the material faster. And of course, it's not without measuring comprehension. And this is a reading sample in which you'll be able to see this little green box or cursor. I'll let you observe that. This represents eyes moving across the page. When we're pausing, we're often decoding a word. Kind of jumping around and rereading. And all of those tests are very helpful. We still haven't completely got into the visual processing piece. So the higher level processing requires that we have accurate visual input. So clarity of vision, tracking, eye teaming, focusing, all the things we've been reviewing. And so therefore it's imperative that we have that functional vision exam first to know what those skills are like, what input is coming in, and do we want to make any interventions with therapeutic lenses? Are there any things we can do right away to make that patient more comfortable? And then we're going to talk visual perception. So a lot of vision is learned. Our brain is constantly given patterns and stimuli, and we have to figure out how to see. We have to learn how to process what we're seeing. So in this picture, does anyone know what you're looking at? I don't know if there's any responses out there. Does anybody, and if you know the answer to this question, I'm going to give you a clue. I'm going to change the orientation of that image. If I can. Does it make any more sense to you now?
We have responses of it's a bee. I still
The
don't
bee?
I don't see the bee. I don't see anything actually, but I also seen it's a cow, meaning the response is cow, bee. I have no idea personally.
So it is an animal, and I love those responses. If I gave you the outline, whoever said cow, you are correct. It is a cow. And now you can almost, it's hard to not see it now that you have seen it. You know, if we go back and forth, here's the outline. Here it is without that visual cue. But imagine being in a classroom full of peers and everyone goes, yeah, it's a cow. How can you not see that? And so this requires visual discrimination, spatial awareness and processing, and being able to tie that visual memory of, yes, I know what a cow looks like, and this is what I'm looking at, and how do we put that together? So I like to use that as an example, especially with a bigger group. We're all calling out different answers. We see different things, which is cool. You know, our brains process creatively and differently, but it can be very frustrating if we're in a group of peers and not being able to see or perceive what they're seeing. So I just like that as an example. And the processing symptoms might show up a little differently than what we talked about for visual strain and squinting and covering an eye, those sort of visual input symptoms. But this is the patient that might avoid puzzles, has difficulty problem solving, difficulty with auditory processing and matching what we hear and what we see. So think about learning letter sounds and matching that letter sound to a letter, or phonemes to a group of letters. Difficulty with spelling. Often that's a sequential memory task, being able to see the sequence of letters. We may have poor reading comprehension, like we talked about earlier, difficulty with memory and recollection, or our performance changes versus in practice and then in play. So I am going to, for time's sake, and I really want to open things up to questions, there is a lot of information on this slide, but the takeaway is this. Visual processing can be broken up into a few different categories. Spatial processing is where am I in space? Where are other objects in space? And what is the relationship between those objects? Visual analysis, much like the cow picture, is visual discrimination. What are the differences? What are the similarities? Can I notice little differences between images? Am I doing an arithmetic problem and I can recognize that I have a plus sign, not a minus sign? Visual memory, for an early reader, this is sight word recognition. Sequential memory, I had mentioned spelling. Visual closure and figure ground. How do we do if we have a full math worksheet with 20 problems on it? Are we distracted? Is that way too much visual input? But we can do the computation if we just block off the page. Can we be able to pick out what am I supposed to look at and what's just background? So kind of that sort of visual processing, getting rid of visual noise. Visual motor integration. This is one that we may not always think about, but there is a big relationship between how we process what we see and what comes out on the paper. So think about it as we see it, we process it, and then what is that printer output like? And oftentimes, it's not so much the fine motor control and penmanship that I'm speaking to, because oftentimes we need an occupational therapist on board to help with that, but it's how do we get organized? Are the letters going down the page and slanted? Are they squished together? Are the spaces way too far apart? Is the sizing and spacing of those letters variable? And that's a visual motor map. You kind of plan that and then execute it on the page. And then again, there is that relationship between processing what we hear and what we see and be able to create a match. So I have a few videos that might help show how would we work on this in vision therapy. I like that relationship of this is what we're seeing with visual processing, and then what do we do to help with it? So I'm going to introduce maybe just a few activities. This one's really fun. It's called the Sanet Vision Integrator. This patient has to be focused on the center. So if that letter flashes, she's got to hit it. And, oh, she's had to go back. She's having to hit them in a sequence, red, white, blue. And what you'll see in a moment, she's actually on a balance board. So we are doing a lot of high-level integration on a balance board, locating in space, where is that object, spatial processing, motor output, selecting the dot, sequential memory, red, white, blue, and tracking. So this is integrating a lot. We may not start here, and it's fun. My patients think this is the biggest iPad they've ever gotten to use, and it is a lot of fun. Visual analysis, we had talked about visual memory. Research estimates, and I might have a few disagree with me who are auditory specialists, but about 80% of classroom learning is visual. And so we need to know, is there a breakdown in that process and how can we support these patients? So sight word recognition, reading comprehension, spelling, difficulty copying, like, what happens if we look at a sentence on the board, but we can't recall that whole sequence of words and we're going to have trouble copying. We almost have to look up every letter, every word to get that on the paper. We run out of time. We might use a strategy like this for some visual analysis. These are matrix cubes. It's one of my favorite activities and games developed by Carl Hilliard. He's a developmental optometrist. So we might do sequencing. We have to track and find the alphabet and move those alphabet blocks to different colors. And we might even have to think of a word that starts with that letter. Then we might even have to call out the colors in order of what we just did. So we can do sequencing, we can do memory, tracking, all sorts of things with matrix cubes. Again, just one example. And then visual motor integration, we just talked about with fine motor and handwriting. And this is a fun activity. We're back to that grid here, or the Sanet Vision Integrator, and she's looking at a grid with a picture. That picture will soon disappear. And from memory, she now has to do this visual motor output, drawing the same picture that she had just seen on the screen. And then she can check for accuracy. She did great. This is a test of visual motor integration. So in this test, it's called the VO Star. The patient has done these two tests about 5 months apart through vision therapy. They're looking in a telebinocular, so they're looking in a visual system. They're drawing from corner to corner until it appears that their lines meet. This patient cannot use feedback of the pencils actually touching because, again, they're in this binocular and they have to understand, where am I in space? Where are my hands in space? And how are things lining up? So ideally, I want it to look like two arrows pointing at one another. On the left side, you see we don't have closure. Really, hardly any of those lines intersect or come together. On the right side, they all cross. And so we don't have balance on the right and left side of our visual system. And you can see the improvement in the second one. It's well organized. They're very symmetric. This patient's handwriting improved greatly. And you can see they're much more organized in space. Auditory integration, again, it's matching what we hear to what we see. And a lot of times we'll use metronome activities in the office to read a chart and try to get on beat and kind of combine those systems together, because we know we don't operate in a vacuum. When we're in a classroom, we have our friends chatting, we have the teacher giving verbal instruction, we have to track with our eyes, and we need those systems to cooperate and not hinder one another. So we'll often bring in auditory when appropriate. And it all comes down to this: having this infrastructure, physical ocular integrity, visual efficiency with our eyes, visual processing. When we are effective in all of these, it impacts greatly our overall performance, our school performance, our performance in sports, our performance at work and in play and in our relationships and interactions. And we have lots of solutions. We can work with therapeutic lenses and prisms, active visual training, ergonomics. Sometimes we'll talk about posture boards, preferential seating. How do we set up this patient's vision for success? I have some patients that may see double in certain directions. So we talk about setting them up for success, putting the visual information where they see it best. And then collaboration. We have got to be working as a team for each child's needs. We're working with occupational therapists, physical therapists, speech language pathologists, tutors, groups like Navigating Education, and putting it all together. This is lots of puzzle pieces at work. And we're here to help with the visual roadblocks that might be in place. And it works. There's a lot of research now. I think that maybe we have always known that this has been a very effective therapy, but now we're getting more documentation and research to show that. So there's a solid link between ocular motor function and reading. And even the Mayo Clinic is showing a cause and effect of if we train saccadic eye movements, those jump eye movements, we can really improve reading fluency. It's kind of the visual mechanics of getting across the page. And here's just a short success story of Lindsay. Her mother wrote this, and she said that as Lindsay was starting kindergarten, she had early signs of great anxiety. She did not want to go to school. She avoided visual tasks. When she came home, she was super fatigued and exhausted, and reading just was not clicking. It was frustrating, and we avoided it. After doing vision therapy, Lindsay's entire demeanor changed. Her anxiety melted away. She became a much happier little girl. Her reading abilities exploded, and she was reading well above her peers, and her self-confidence blossomed. And what I like about this story is that not only did we see an improvement with reading, which is why we started, but it helped her unlock this potential and the confidence. And that is so important for our success moving forward in school, is to support these children, go, hey, you can do this. You know, like you said before, Melissa, it's like your eyes are working so hard and they don't have to be, or we're working so hard on this visual process, and let's give you some other tools to process what you see. And if you're interested, here are some more resources. Our website, which is hbvision.net, lynnhellerstein.com is a wealth of knowledge, lots of resources, articles. COVD.org, this is a group of the College of Optometrists and Vision Development. So if you don't happen to be in Colorado, or we're outside of an area that you can access, if you go to their website, you can do a doctor search, put in your zip code, and you can find a developmental optometrist in your area to do a similar type of functional evaluation for you. AOA.org, that's the big national optometry group, and Nora Vision, I just threw out there for patients that might have had a concussion or a brain injury. And I can always go back that. Yeah, thank you.
Thank you so much. We're going to move into our question and answer part of this, because there's already a question there, and then I wrote down a couple of questions. So if there's anybody that has questions for Dr. Amy, please put them into the question Q&A. It'll be sent over to us and we can ask Dr. Amy directly. Also, if you're watching this as a recorded, if you put it into comments and things, it will notify us, and we can always send some questions over to Dr. Amy and get some conversation going there as well. Okay, so Randy asks or says that they have a son who's visually impaired, CVI, and I'm also a teacher and a tutor. When I see these red flags for vision impairment and parents say that the eye doctor said that their eyes were good to go, what can I do what can I recommend?
That's a great question. So I would ask a couple of key questions can help identify if they've had a functional vision exam or not. So when we say we had a clean bill of health at the eye doctor, a good follow-up question is, did they check eye teaming, tracking, or near visual focus? So a lot of times if we're not kind of checking those boxes, we may not have had more of a functional exam. And it's not that it's not thorough, it's that it's looking more at the structural components, the refractive error or need for prescription. So that would be my first question. Great, you had an eye exam. I'm so happy to hear that so-and-so's eyes are healthy and working well together. Did they look also at tracking, eye teaming, and visual focus up close? Because And then you could talk about the symptoms that you see, because I'm seeing that your child is fatiguing with reading and losing their place, and that might be a sign of tracking deficiency or difficulty using their eyes together. And then you could send them us as a resource, or covd.org, so that they can get plugged into other functional optometrists that might be close by to them.
That's great. Thank you. When you were talking about a couple of different things that I heard from you during your presentation, one of them was a holistic approach, when that it's puzzle pieces, all of these different pieces and working together. And with my background, I spent the first part of my career was in the school system, public school system. And I love your idea of this holistic approach of, getting if it's visual therapy, but then it could be that hand-eye coordination for the OT at the school, and really working together in a holistic child approach to meeting their needs. That the vision therapy, maybe the child has that, and then also has some OT within the school, and then talking across. I love that idea of that these do bleed in together, and by working together in a holistic approach, I really think that could be really beneficial for our kiddos, because at the end of the day, we want the kids to succeed. We all have that same goal. We may have a different way of viewing it. And I always like to think of it as what perspective might be missing in the room as we're talking about some things. Could it be a visual and then the motor? Is it a visual motor component that we need both perspectives and work on both systems to be able to, that they're going to benefit each other, And so instead of working in silos, I love this idea of working together holistically. The other thing that you had mentioned, it'll lead into a question, is building empathy in school systems. Even without the video, when I see how much the child is working, to strain, to try and focus in on something, it helps me think of, I really wish that a teacher could see that, that to see how much they are trying, that it's not a matter of them not trying. It's just that they don't have the skills yet. Just like if I'm trying to throw a basketball, if I am not taught how to properly throw the basketball, or with a coach to properly throw the basketball with a skill, then I may never be able to develop that skill better, right? But I'm trying really hard. It's not a matter of the trying. And I love the idea of building this empathy for people that are working with these kiddos. It leads me into influencing some interventions. This visual noise, like if you're at a restaurant, you hear a lot of things and you have a hard time attending to the person sitting across from you. I can imagine that building the empathy on the side of visual, when you mentioned the visual noise on a page, a mathematics page you mentioned, and just covering it up, those are interventions that accommodations that we can do in class that don't take a lot. And there's not going to probably be just one kiddo that probably needs it. There might be a few, but things like that. Do you have any other ideas for like quick interventions that that a teacher, para, somebody working with this child could do, a parent sitting next to them with homework, if they do struggle with these visual things besides the math things?
Yeah, that's a great question. So when we have our comprehensive visual processing eval, we will create for patients seen in our office a written report, and we'll share that with you. Of course, we'll share that with teachers, tutors, 504 and IEP planners. So a lot of our recommendations are there, but on a broader scope, a couple of things that I think would be beneficial to a child that's having trouble with lots of things on the page would be, one, you could cover it up. Two, you could enhance the font or make it bigger. So instead of 10 problems on a page, we have larger problems, 4 problems on a page. The other one I really like is for math specifically. If we are struggling with the alignment of the problem, like let's say now the patient is of the age that they're copying the problem themselves, and we're making errors because our columns are not aligned, Graph paper can be helpful, but I find those boxes to be very small. So I have suggested to my patients they could take college ruled paper and turn it this way, and now they have columns. So that's one thing you can do if your child or your student is having trouble lining things up. Just turn that college ruled paper on its side and use that as columns to help you with alignment. The other thing with copying, so we talked about visual motor, handwriting. If they're struggling with the memory piece, so they look at the board, they see a few words and they're struggling to get it down to the paper, reduce that distance. Maybe you still want them to do the handwriting component, but they have a copy of notes right there next to them on their desk. And so they can copy directly from that. Or for some of my high school students, teachers will provide notes with blanks. So it's most of the lecture with a few blanks so that they are paying attention, they're following along, and they only have to fill in certain keywords or answers. So partial notes could be given, a copy of the notes could be given, copying on our desk. That'll all reduce the demand, at least to some degree.
I'm
What
wondering,
else?
would this one just pops into my head, and I don't have your background, so I'm wondering if this might help. What do you think about if a child had an accommodation to take their phone, take a picture of what the teacher's doing, and then put it on their desk, and they can zoom in to take notes there? Like if a copy of a note can't be provided beforehand, do you think that, or is that too much to try and tackle?
I think depending on the age of the patient, so certainly our like high schoolers, middle schoolers, I think they could do that pretty well. The only thing that I would be concerned of is if just from a screen time kind of demand thing, if that causes a distraction or Susie gets to have her phone in class and we're not always consistently making sure that she's only using it for note taking, I think that might be a little bit difficult, or I could see some teacher push back on maybe having our phone out to take images. But I do think for the most part, even if they can't do a printed copy, if they could provide it after, or having a scribe. I mean, some classrooms are set up to have like a note share or somebody taking notes and being able to provide that to the patient afterwards. And then I often get the question of like a bookmark or a reader, like, can we cover the page and read? I think for the short term, that's a good strategy. So you're not as overwhelmed on what's on the page, but ideally, we really want that child to improve the visual skill to be able to track without the aid of a finger or a bookmark or a window reader. But I think in short term, until we're able to address it or train that skill, you could use those kind of strategies too.
Right. Trying to think of if there's any other questions. I haven't seen any other questions come up on the Q&A. I think the thing that I'm leaving with today, well, many things, but one of the things that I'm going to leave with today is this idea of the empathy, and knowing that all of us are doing as best as we can with the information and the skills that we have at this time. And to build that idea, to extend it into the school system and to our kids, that the kids are doing the best they can with the skills that they have at this time. Just like a child that might have a difficult time learning to write, to read, those types of things, they also, it may be due to these visual components, and having a way to look at it differently, to think about things in a different way, that it's not about that they're not just trying, you know, that if they could just, what I hear a lot from parents is what they've heard, especially if they've gotten into secondary school already, so middle school, high school, is, Melissa, they every year we just hear that if they could sit down or they could focus more, that's the input that they're getting from the adults in that child's life. And I want, I guess, to send the message of, if we think about things differently and expand, that it may be due to some skills that are lagging behind. And it could be this visual piece of the visual memory, the visual motor integration, and how much different that child's self-esteem, when you mentioned had the the picture of, before and after for this family, and how much the affect had changed and the anxiety had been reduced. I just think it's such a great service that you guys provide for families. And before learning more about visual processing, I didn't realize how much that could impact a child's academic ability. And I have just heard so many wonderful things from families that have visited your office, and they come back and they're just, I get emails. I need to send them on to you guys. I'm not sure why I haven't, but just saying, we couldn't figure out what was going on. We couldn't figure out what was going on. You let us know about their office. We went up there, and our child has had now some visual processing therapy, and they're thriving in school. And it thinking about things differently, and instead of silos, breaking those silos down and doing a holistic approach of what else could be going on for this kiddo. Let's talk about it. Let's think about it. And I just encourage those watching that if you see some of those signs on that Dr. Amy had shared, that you reach out and give them a call, and or reach out to some of the resources if you're in a different state. So thank you so much. Oh, there's one that just came up. Christina says, we're going to practice my visual tracking, and I hadn't previewed it. Christina says, with psychological educational testing, I often give cognitive tests and find a weakness in visual spatial ability. Typically, this is impacting the students academically across the board, and so it's less of a learning disorder and more of a visual processing issue. Do you have any advice on how to explain this to parents during a feedback session? As psychologists, we're limited in the amount of visual tests we give and the knowledge that we have in this area. Thank you so much.
Sure. So I will do my best. So thank you, Christina, for your question. Often, and I think what I'm most familiar with, and this is outside my wheelhouse, is what you're providing with that global educational evaluation. You have to test a lot, many more areas than we are testing in our evaluation. We have the luxury or the benefit of just focusing on the visual piece. So you might do a speed of processing test, or a visual coding test, or a block design test that might yield a result like you're talking about, where you're going, yeah, I'm seeing this visual spatial thing showing up. And what you might start with is, I see a lot of these high areas, or this patient or child doesn't really meet the criterion of a learning or learning difficulty in these kind of concrete diagnoses. But what I'm seeing is when they have a visual task, when they have visual stimulus presented, there's a mismatch in their processing. And so they might struggle with, and I try to create a relationship to where you see it academically. They might struggle with remembering what they saw. They're reading a paragraph, they recognized a word, next page, same word, can't recognize it. We're having trouble with that short-term visual memory, or spelling difficulties. And so it might be easier, because you have the benefit of knowing the child and how their performance is impacted, to make that relationship of this will impact them in reading and comprehension and spelling and handwriting organization, even though it may not fit these clinical diagnoses. And then I would highly suggest referring to a functional optometrist to look at visual skills, because sometimes, yes, it is the process. It's trouble with memory or coding or finding a match between something, but it also could be that visual input or mechanics, which you won't have time or maybe the tools to assess during that visit, to say, there could be something going on with tracking accuracy, because their performance on this other test, and we see a lot of gifted students and patients that perform really high here, and then they either visually fatigue, and we go, why did we do poor at the end? Or they could do one task or not the other. And so you could say it could be a trouble with tracking or getting their eyes to move accurately on the page, or it could be that they were having trouble with convergence, and so their stamina was reduced. So short answer, I would say, try to relate it to where you're seeing the deficits in performance and how that might relate to visual processing, and then see if there's a provider that could maybe assess those visual skills, and then visual processing, we break down into visual discrimination, spatial awareness, visual closure, figure ground, visual memory. And we might be able to better point to which area of the visual process is impacted the most.
Yeah. To build off of what you said, Dr. Amy, I think sharing this webinar, it'll be on our YouTube channel. So sharing this webinar with the family, sending the link directly to them so they can hear what Dr. Amy's saying. And then if they're in a different state or anything like that, using some of the resources that she mentioned to refer out for it type of thing. And so any of our social media, including our YouTube channel, is going to be at Navigating EDU, for short for education. So company's name is Navigating Education. All of our social media is at Navigating EDU. You're welcome to follow our YouTube channel, because these types of questions, you're exactly right, Christina, that how do we help them find the next step in the process, right? And so this is why we want to do these frequently asked questions series, is because these are the questions that families are asking. And so this gives them an introduction to what is visual processing and what should I look for before I spend a lot of money to need to have the testing done. Is it necessary for my child? I don't know, because I don't have the degree to know how to help them. So having this frequently asked questions, you can always share the link with them from Navigating Education and our YouTube channel. Well, thank you so much, Dr. Amy. Anything else that you'd like to, any other words of wisdom? You shared so much, and I feel like I'm very excited to process what you've talked about today, but anything else you'd like to share with us?
Just a big thank you. I really appreciate you inviting myself and really our group Hellerstein and Brenner to speak. It's something I'm really passionate about and I just love being here. And I want to thank you for your time, for everyone's attention and participation. And I guess really what I want to convey is that I think this is a fairly underdiagnosed sector. We're often thinking of pointing to different diagnoses, and I just want visual processing, visual mechanics, binocular vision to be at the table. And I think that, like we said at the beginning, 1 in 4 children have an undiagnosed vision issue. And so I think just more awareness, both for parents, educators, collaborators, and colleagues like your group is just so helpful to get the word out and to get more children the help and support that they might need.
Yeah. Well, thank you so much for joining us today, Dr. Amy.
Thank you.
All right. Thanks, everybody, for joining us.
Thank you.